Dr. Mishika BHASIN.
Wrong slides have been opened.
1226.
Good afternoon, respected judges. I'm going to talk about to evaluate the conjunctival bacterial flora in patients undergoing cataract surgery. As we all know, the conjunctival sac is colonized by bacteria at birth and remains so throughout the life with changes in the flora due to various factors. The normal commensal flora can protect the host either by occupying potential colonization sites of pathogens, producing antimicrobial products, or stimulating an immune response that protects the host against infection. However, random or surgical penetrating trauma can promote the migration of resident bacterial flora into the eye, leading to endophthalmitis. Once superficial flora enters the eye during cataract surgery, several prophylactic measures are applied to suppress or limit the growth of these microorganisms, which could lead to endophthalmitis. So, aim of my study is to evaluate the conjunctival flora in patients undergoing cataract surgery, and objectives are to identify the conjunctival bacterial flora in patients undergoing cataract surgery and to determine the sensitivity pattern of the conjunctival bacterial flora in patients undergoing cataract surgery. A cross-sectional study was jointly conducted in the Department of Ophthalmology and Microbiology on 60 patients undergoing cataract surgery. The type of the study is a cross-sectional study and the sample size is 60. Inclusion criteria include all the patients undergoing age-related cataract surgery in a tertiary care hospital. Exclusion criteria, patients with local inflammatory disorders like chronic conjunctivitis, dacrocystitis, blepharitis, mebomitis, patients using topical antibiotics during the last 4 weeks before conjunctival sample collection, patients on oral or topical corticosteroids or immunosuppressants, patients having previous history of ocular trauma, intra or extraocular surgery, and those wearing contact lenses, patients having uncontrolled diabetes or hypertension, patient with any other ocular or systemic abnormality, and patient undergoing cataract surgery for other than age-related causes. Standard preoperative workup was carried out, including the best corrected visual acuity, slit lamp examination, and to rule out the local ocular abnormalities, fundus examination, and blood pressure and blood sugar levels. Conjunctival sample collection was done. Microbiological analysis of the sample was done. So in my observation, the total number of the eyes, growth was positive in 49 patients, while there was no growth in 11 patients. The coagulous negative Staphylococcus was the commonest bacteria isolated in 29 eyes, followed by Staph aureus in 8 and diphtheroid in 4 cases. The susceptibility pattern of all the isolates shows 100% sensitivity to vancomycin, followed by moxifloxacin and getafloxacin. The coagulous negative Staphylococcus showed maximum sensitivity to getafloxacin, moxifloxacin, and vancomycin, and leads to neomycin. And this insensitivity pattern of Staph aureus, 100% sensitivity to moxifloxacin, getafloxacin, vancomycin, gentamicin, and then cefotaxime. So in this study, we were able to isolate bacteria in 49 eyes. In a study done by Arentes et al., the cultures were positive in 86% of eyes, while a study done by Terence et al. Showed isolation was of the order of 80%. In this study, the most frequently found organism was coagulase negative Staphylococcus aureus. This organism is related to approximately 70% of the cases of post-surgical endophthalmitis. This confirms, as with other studies, the CNS is the most common isolate in conjunctival bacterial flora worldwide. With regards to sensitivity patterns, particularly in case of CNS, moxifloxacin, getafloxacin, and vancomycin were found to be the most effective. A reduction in susceptibility rates of the older quinolones Compared to the latest generation quinolones, moxifloxacin and getafloxacin was observed. The number of the CNS isolates resistant to 4 or more antibiotics was lower than 39% described by Ta et al. And one found by Pinna. Our results imply lower rates of ocular colonization with multiple resistant bacteria and demographic differences in the resistance pattern of the ocular flora. No fungal flora was cultured in any of the cases. Another point to be considered in that antibiotic sensitivity were performed in vitro and might not reflect the real efficiency of these antibiotics in vivo. In addition to the diffusion sensitivity test technique is based on the serum concentration of the antibiotics that might be differentiated from the concentration in the conjunctiva with the topical use of eye drops. Thank you.
So, good one. And how much resistance with moxi was seen as compared to Getty? Was there a, yeah.
Ma'am, for staph aureus, moxifloxacin was 100% sensitivity was there. Whereas for CNS, the moxifloxacin was resistant followed by getafloxacin. Getafloxacin was 100% sensitive.
Yes, because we are nowadays coming up with, even with resistance coming up to moxi also.
Yes,
That
yes,
is
ma'am.
That is the whole point.
Yes,
and
ma'am.
what organisms you have described in your flora is as per the other studies and the most predicted ones.
Yes, ma'am.
So these were normal patients. They didn't undergo any syringing before you took the swab for these patients.
No, ma'am. These patients didn't went syringing.
They had any manifest discharge, or it was just a study to see these were the patients who were undergoing cataract surgery.
Yes, ma'am.
So
these were the patients that were about to go for the cataract surgery. So we studied normal commensal flora in them only.
Right. And what is the usual antibiotic you give pre-op for your cataract surgery patients?
Ma'am, we usually give moxifloxacin only in our setup.